decided to go to the University of Nebraska-Lincoln, and I was studying journalism. I was in the journalism college in advertising and public relations. I also had a part-time job as a waitress, but I was really tired all the time, and I always was calling in sick, and I didn't really know why it was so hard for me. Right when I got off of work, I would just go home and sleep, and I didn't understand why I wasn't like the other employees there and why I couldn't keep up, and I just was totally having flu-like symptoms, and you know, I'd get the chills, and then I'd get so hot, and then I was having digestive problems, and I would wake up just drenched in sweat, and my clothes and my sheets would be just soaked. That's when all the trips started to the emergency room, and I probably 4 or 5 trips during the months of April and May. And every time they just told me, you know, you just have the flu, and that's when I came home to Omaha for the summer. I went to the other hospital, and it was just started going downhill from there, and they came in initially after a biopsy after a couple days and told me it was cancerous, but they didn't tell me, you know, we didn't have a diagnosis. Meanwhile, my stomach was blowing up like I was pregnant, and my lungs were filling up with fluid, and I had to have my lungs completely drained multiple times, which was totally painful. And
the day before, we're bringing her in because she's tired, and the next day she's getting a blood transfusion, and we still have no idea what's wrong with her. At this point, she was in ICU, and everyone's like, what is going on? Nobody is diagnosing her or getting to the bottom of it. It was just a big waiting game.
Then they put me on oxygen, and they were monitoring my heart because I was up to like 150 beats a minute. It was a really scary time. I remember my mom came in, and she was like, I talked to my friend, and she knows someone at the Nebraska Med Center, and she's like, we need to get you over there right now. And my mom just told me that the Nebraska Medical Center was where I needed to be, and everyone was telling her, you know, if it's cancer, there's something wrong, you need to move her over to the Med Center.
She had to go directly to ICU at the Med Center, and within an hour, it was just like, you know, you finally felt like she was going to get a diagnosis for sure, because this great doctor that's the head of OB/GYN in the ICU at Med Center came in, and he assessed with all the interns around her bed every single thing that had transpired, you know, in the month or two before, from her night sweats to her anemia. When did this start? When did that start? And they all were outside, you know, huddled, and within I'd say probably 2 hours after we checked into the Med Center, they came in, several doctors, and said, we know what this is.
They came up with their diagnosis of sporadic Burkitt's lymphoma, which is a type of non-Hodgkin's lymphoma.
We knew she was sick, so we had them take a look at it right away, and once we had a diagnosis, then we knew what to do. But we're lucky to have several world-class hematopathologists here who were able to make the diagnosis. The kind of lymphoma that she had is relatively rare. This is only about 2% of people with about 2% of lymphomas are her kind of lymphoma. This is something we don't see every day either, but we see several cases a year, and I always think it's good to go to a place that has more experience treating this. This is one of the more aggressive and rapidly growing kinds of lymphomas, maybe the most rapidly growing kind of lymphoma there is. We have a particular regimen we use for this, and you know, we got her started on therapy right away.
Basically, they told us chemo needs to start tonight.
Doctor did come in, and he said, we think we can cure this, and I mean, hearing that totally changed my outlook, made me think, okay, well, maybe I'm going to be okay.
I'll never forget the one doctor in the ICU said, this is one that we can cure. This is, if you could be any hospital, anywhere in the country for any cancer, this is like the best one to have and the best hospital to be in.
Dr. Bierman and the other nurse practitioners on the oncology floor were just always really great, and I could tell they always had my best interest at heart, and he'd reassure me that you're going to be fine, and this is curable, we'll have you out of here in a few months. Right when I got to the medical center, my mom was just saying, I can't believe we weren't here all this time, and you know, because just the level of care was just on a completely different level than what we had experienced at the other hospital, and it was just so clear that we were at the right place.
There's a huge difference in between what one hospital prescribes as the chemotherapy regimen versus another hospital. The med center, and I can thank God now that they made a choice to give her this particular chemo that she got.
This is one kind of lymphoma that gets treated different than other kinds of lymphomas, and you have to dot the I's and cross the T's because the goal is to cure.
I just started feeling good. Like, I remember you weren't really supposed to go out, but I was going out because it was summertime, and my energy levels just really felt good, and I kind of felt at that point like I think I knew that I was healthy. Once I got that initial all clear, it was just completely, I knew my life was going to be completely different, obviously.
A lot of the people that I correspond with on these, like the Burkitt's lymphoma site on Facebook, question, where should I be getting treatment? And a lot of them, even before I even tell them, a lot of them are saying, I'm being sent to Omaha to go to the med center. My doctor recommended I see the specialist there, Dr. Bierman, or like from Kansas City, a guy from New York. And one of the guys from New York said, gosh, my friends were saying, isn't there any specialists in New York? You have to go to Omaha to find a lymphoma specialist? No one can believe it, but their people are going to the med center from all over the country.
I feel so fortunate to have been treated at the med center. Because my cancer was so rare, it needed to be treated the appropriate way, and so many hospitals don't put Burkitt's patients on the chemo regimen that I got, which is really the best one to get, and they did everything preventative so the cancer wouldn't come back. If it's cancer, if it's something serious, you need to be in the best care, and people come from all over the world. There were patients from all over the world on my floor, on the oncology floor that I was on, and I know from all over the United States people come to the Nebraska Medical Center, and I can't believe I was so fortunate to live just 10 minutes away from, a world-renowned hospital.
It's so great to see patients as they go through their treatment. Of course, it's very difficult, and they have a lot of physical changes that they have to go through, and especially for a young person, that would be really difficult. But she has done a great job of getting through that and getting on to her next aspect of life and taking those things that she's learned through her treatment to be able to help not only herself but other people, and that's really helpful. And it's really gratifying for us to see that happen, that we can take someone and cure them of their lymphoma in this case, or other cancers, and be able to get them back to normal life. We have a great team here that when the patients come in, we evaluate them very quickly. We're fortunate to be able to have excellent pathology to be able to give us the answer of what type of problem they have, be able to have access to all kinds of new treatments, and get the patients on the road to recovery in a very fast time, and not just with Burkitt's patients, but with every patient. In the Midwest, we would be one of the premier lymphoma centers, and I think if you ask anybody nationally, we'd be one of the premier lymphoma centers as well. The next step is for us to take what we built upon in the base and try to expand upon that with better clinical programs, additional research opportunities, new therapies and drugs for patients. Kind of the future holds for us is to try to take the research that we've used and developed over the past several years and to develop that into new therapies for patients. So based upon our research, a lot of the information is now being used to develop new therapies for patients. And a lot of those therapies are based upon pathways of cells, so that we can target those cells just by medications that are against the lymphoma and not against the normal tissues, so that there's less side effects for patients. And that's really where a lot of our research is going.